If you've been experiencing migraines or jaw pain, it might not be all in your head, but rather a problem with your dental health. Dr. Kheir with Evolution Dentistry joins us with more on how they can help with anything that has to do with your oral care. Good morning.
Good morning to you.
All right. So, sometimes we forget that all these different body parts are all connected to each other, right? We focus on one thing. The other thing we mentioned earlier, we want to address symptoms. So like for migraines, oftentimes we're like, what medication can I take to make the pain go away? You want to work on what's the source of that pain?
Exactly. Migraine headaches are true and also treatable by migraine doctors, but also that migraine headache could be a result of secondary problem which is related to the muscles of mastications, or your TMJ is out of alignment. That's due to your teeth being also broken or out of alignment too.
And that's why it's important whenever we sit down and we fill out, the questions, or a dentist will say to you, tell me what's going on. What are you dealing with? It's important for us to say everything because you may be able to connect the dots the way that we aren't.
Absolutely. I use a multidisciplinary approach to the patients. I focus on not only what broke the teeth, but what caused that tooth to break. How is that? Because they could be due to the TMJ is out of alignment. So instead of fixing the condition they're in where the joints are out of place, I look at the joints, correct them, and then also take care of the tooth problem.
Yeah, go through that treatment process. All right, Evolution Dentistry. It's a collaboration with you and your partner, Dr. Matthew Gimp. Between the two of you, you've got about 60 years experience. But
Correct.
What's nice about this is that, I remember times when my mom would go to one dentist for one issue, another dentist for another issue, another dentist for, and even I had to go to different dentists. We can get everything done with you.
Correct. Absolutely right. We take care of not only, again, like we said, the denture problem or the teeth problem, but the TMJ and also the migraine headache, neck headache, ear headache. We have many patients that are referred from other doctors for ear pain, yet they don't have any ear infection, or eye pain or around the eye pain. It's also related to TMJ issues.
Yeah, as we mentioned a couple of times today, how patients normally are. We show up when we're in pain, right? So dental health care versus disease care. You have the full gamut to help us avoid what we can, right? Yep. Starting with, just even the simple part of keeping it's a Texas-sized toothbrush, you like that. But just keeping our teeth clean, getting our cleanings. The importance of the cleaning is more than just clean teeth. You can see problems that might be on the way or already there.
Absolutely. Prevention is the key for any kind of treatment. If we catch it early in time, you'll save yourself a lot of headaches and trauma and probably damages that could happen. Yeah. While you're having your teeth clean and monitoring it, we do an exam at the same time, catching stuff early in time to prevent further problems.
Oral cancers, for example.
Exactly, we do that.
Yeah.
Yes.
All right. You have exams and cleanings, preventive care, as we said, but you also have, this is the thing that we don't need to be prompted to come in for oftentimes, and that's the cosmetic. Right? We're looking at some differences here that you do. You can go as far as if you need dental implants.
Sure, absolutely. Absolutely. It's the best replacement for natural teeth is having implants, not bridges. Bridges are also a great thing to do, but for one tooth loss, we would replace it with one tooth replacement, which is an implant. Unless the patient wants cosmetic like you see there, then we look at the entire things and we do complete makeover of patients.
Yeah, implants, crowns, all that. There's also an implant retained denture.
Exactly, yes. It's all on X or all on 6 or all on 5. Basically patients who've been wearing dentures but they're loose with time. So we diagnose them and put in some implant and let that denture locked into their implants so they get more, kind of increase their quality of life that way, yes.
Dentistry, like all medicines, is constantly evolving.
Absolutely.
You have something in your mouth right now that might look like yesterday, but it's really today and beyond.
Absolutely. I'm going to show it to everybody. Here you go. I'm wearing braces. I decided to do that because I wanted to convert completely my mouth to a newly aesthetics zone. So I'm wearing braces. I've been wearing them for about 2 months right now. And I'm very happy with the result.
Yeah, because it moves faster, doesn't it?
Absolutely. This is a fast braces that move faster, yes.
Yeah, because I know for a lot of people who have the clear liners, that's okay, but you got to be diligent about it. You got to keep them in all the time. This way, it takes care of it for you.
Absolutely.
Yeah. All right, what's the biggest mistake people make with their teeth and their oral health?
Neglect.
Yeah.
Neglect.
Yeah. And
like
I know
anything in life, once you neglect it, you don't take care of it. And the oral cavity is part of your personality, social life. If you start neglecting them, discoloration, breakage in the front teeth, you'll end up not knowing, but you're in a situation where you're not comfortable how you present it to people.
Yeah, yeah.
So that's what we're trying to change. We could help those people come up to basically increase their, or improve their quality
And
of life.
unfortunately, this is one of those things that the more you put it off, the worse it's probably going to get.
Absolutely.
And I want to make this point because I hear this so often. People say, I know I need to go to the dentist, but I'm so embarrassed. Don't be embarrassed.
Absolutely not. Everybody has those problems at different degrees. We'll take care of them like they need to be, and we'll bring them to the one. Most of the patient that comes in, I want to look like what I looked in 20 years ago or 30 years ago. And we're able to convert those patients to that. And they're so happy when they have the results.
Yeah.
I could see their feel of joy when we did this to them.
Yeah, which is why you love the job so much,
Absolutely.
Dr. Kheir. Thank you very much.
You're welcome very much.
All right, mention Great Day Houston when you make an appointment at Evolution Dentistry, and you'll receive a 25% discount for your first visit. To book an appointment, visit their website, evolutiondentistryhouston.com, or call this number, 713-647-8000. Again, that's 713-647-8000.